State of Cannabis.
This is the State of Cannabis News Digest, a roundup of this week's key developments in the cannabis industry.
Good morning. It is Saturday at 9 o'clock, and this is your weekly briefing on cannabis policy, business, and regulation across the United States. This week, Washington lawmakers return to the debate over federal marijuana prohibition, while states confront the practical consequences of the divide between federal and state law. California is examining banking barriers. A bipartisan Senate bill targets insurance access. Alabama is deciding how to respond to a narrower federal scheduling change. Hemp and CBD businesses face more immediate deadlines. Florida companies are preparing for a federal THC limit that could remove much of the existing market. Virginia retailers are planning a legal challenge to tighter product rules, while Oklahoma businesses await new packaging standards. Medical cannabis is expanding, but unevenly. Georgia is recording rapid patient growth. Nebraska is building a tightly controlled market with substantial licensing costs. And in Massachusetts, a delivery industry that has generated tens of millions of dollars now shares the political stage with a ballot measure that could end recreational stores and home cultivation. Stay with us. We will take each development in turn and explain what it means for patients, consumers, and businesses. This broadcast uses AI-generated voices to make the program clearer, more varied, and more dynamic. The reporting, writing, and editorial decisions are guided by our news team. The voices allow us to present the program with greater range, pace, and personality. Here are this week's stories.
And now here is the deeper look at the key events in the cannabis world this week.
A group of Senate Democrats is making another attempt to end federal marijuana prohibition. Pennsylvania Senator John Fetterman has joined Cory Booker, Chuck Schumer, and Ron Wyden in reintroducing the Cannabis Administration and Opportunity Act. The bill would remove marijuana from the Federal Controlled Substances Act. It would also automatically clear qualifying federal records for nonviolent cannabis offenses and allow some people serving federal sentences to seek resentencing. The proposal goes beyond changing marijuana from one federal schedule to another. It would end federal scheduling altogether. For the cannabis industry, that distinction matters. Marijuana businesses would gain access to ordinary federal tax deductions that are currently denied to companies handling controlled substances. The bill would also establish national standards for production, labeling, and sales. A federal cannabis tax would help fund job training, legal assistance, and reentry programs in communities affected by prohibition. The legislation would create a Cannabis Justice Office within the Justice Department and remove certain cannabis testing requirements for federal workers. The bill faces an uncertain path in Congress, but it establishes one side of the national debate clearly: whether marijuana should remain federally controlled at all. Even full federal legalization would not automatically create recreational stores in every state. State lawmakers would continue to determine whether adult use sales are permitted and how local markets are regulated.
While Congress considers full descheduling, Alabama is focused on a narrower federal change involving certain medical marijuana products. Under Alabama law, a federal drug scheduling decision normally begins an automatic state reclassification process. State health officials may object, however, allowing time for public testimony and further review before a final state decision. Alabama filed that objection in May. State Health Officer Scott Harris said the action was not intended as a rejection of rescheduling. Instead, officials wanted more time to examine how the change would interact with Alabama's developing medical cannabis framework. The State Committee of Public Health set a public hearing for July 22nd, and written comments remain open through August 5th. The The federal action applies to marijuana products regulated through state medical cannabis licenses and products approved by the Food and Drug Administration. It is not a blanket reclassification of all marijuana. For Alabama, the question is primarily administrative: how to incorporate the federal change into state rules governing medical cannabis products, licensing, distribution, and enforcement. The review does not create a recreational market. Patient access and business requirements remain governed by Alabama's existing medical cannabis system while the state considers its next step.
California is returning to one of the cannabis industry's most persistent business problems: access to ordinary banking services. State Treasurer Fiona Ma is holding an informational hearing on July 29th in Sacramento. Government officials, financial institutions, regulators, and cannabis business representatives are expected to participate. California licenses both medical and recreational marijuana businesses. Federal law still prohibits marijuana, leaving banks and payment companies to navigate conflicting legal systems. Some financial institutions serve cannabis companies, but access can be expensive, limited, or unreliable. Businesses may struggle to secure loans, process payments, or complete routine transactions. Others continue to handle large amounts of cash, creating additional administrative and security risks. The hearing will revisit work that began with California's Cannabis Banking Working Group in 2016. Officials will examine what has improved, what barriers remain, and which problems the state might address without waiting for Congress. The hearing will not require banks to accept cannabis clients, nor will it resolve the underlying conflict between federal and California law. Its purpose is to identify practical measures that could improve financial transparency, reduce cash-related risks, and make lawful business operations more manageable.
Banking is not the only financial service that remains difficult for legal cannabis businesses. North Dakota Republican Senator Kevin Cramer and Arizona Democratic Senator Ruben Gallego have introduced the Clarifying Law Around Insurance of Marijuana Act, known as the CLAIM Act. The bipartisan bill would prevent federal agencies from punishing or discouraging insurers that work with cannabis businesses operating legally under state or tribal law. Its protections would extend to insurance companies, brokers, agents, and employees. Federal regulators could not pressure an insurer to cancel or reduce coverage solely because a client grows, manufactures, or sells marijuana legally. The proposal could affect property, casualty, and title insurance. These policies help protect buildings, equipment, and inventory, and they may be required before a business can obtain financing. The CLAIM Act would not force insurers to offer coverage. Companies could still reject applicants, limit policies, or charge higher premiums based on their assessment of risk. The bill also covers businesses that provide services to cannabis operators. It directs the Government Accountability Office to examine financial and licensing barriers affecting minority-owned and women-owned companies. This is the fourth consecutive Congress in which the proposal has appeared. Earlier versions did not become law. The measure is narrower than federal legalization. It would not change where cannabis may be sold, but it could make one ordinary part of operating a legal business easier to obtain.
Florida's hemp industry is preparing for a federal deadline that could reshape what farmers grow and what retailers sell. A federal spending law passed in November 2025 changed the definition of legal hemp. Instead of focusing primarily on Delta-9 THC concentration, the new standard measures total THC and limits a finished product to 0.4 milligrams per container. The rule is scheduled to take effect November 12th. The U.S. Hemp Roundtable estimates that roughly 95% of existing hemp-derived products would fail the new test. The impact could extend beyond intoxicating gummies and THC beverages to full-spectrum CBD products containing small amounts of naturally occurring THC. The uncertainty is already affecting business decisions. Treadwell Farms in Umatilla would ordinarily have supplied planting material to about 20 farmers by this stage of the season. This year, it had supplied about 6, and those customers purchased less. Retailers are also exposed. Michael Smith, the owner of Urban Flow in St. Petersburg, says hemp-derived THC products account for about 80% of sales at his 2 stores. President Donald Trump has asked Congress to protect consumer access to full-spectrum CBD while maintaining restrictions on products considered dangerous. Budget Director Russell Vought has also called for revisions to federal hemp policy. Another proposal, the Lawful Hemp Protection Act, would replace the pending restriction with a taxed and regulated system. It would establish an alcohol-style distribution structure for hemp beverages, an approach that has divided businesses within the industry. The central question is whether Congress will act before November 12th and whether any change will protect only full-spectrum CBD or the wider hemp-derived THC market.
Virginia hemp businesses are preparing a federal court challenge to a product definition change scheduled for August 15th. Current state law limits hemp products to no more than 0.3% total THC. A product must also contain no more than 2 milligrams of total THC per package, or maintain a ratio of at least 25 parts CBD to 1 part THC. The August change removes the ratio option. That distinction is important for large or multi-serving CBD products. A product may have a low THC concentration but contain more than 2 milligrams across the full package. It can qualify under the present rules when its CBD content is at least 25 times greater than its THC content. After August 15th, that route to compliance disappears. District hemp owner Barbara Biddle plans to join the legal challenge with another retailer and several manufacturers. Former Virginia State Senator Chap Peterson will represent the businesses. The plaintiffs intend to seek an injunction that would give companies additional time to reformulate products and protect employees, suppliers, and existing investments. The dispute comes during a gap in Virginia's cannabis system. Adults may possess limited amounts of recreational marijuana, but licensed adult-use retail sales are not scheduled to begin until July 2027. Some hemp products could therefore leave store shelves almost a year before recreational cannabis retailers open. During that period, medical cannabis companies remain the only businesses authorized to sell marijuana. The planned case concerns hemp and CBD regulation. It does not challenge Virginia's future recreational market.
Oklahoma's medical cannabis industry is preparing for new restrictions on edible products and packaging beginning November 1st. House Bill 4454 prohibits words, images, and designs considered likely to appeal to people younger than 18. The restrictions include cartoons, toys, animals, depictions of minors, and packaging that resembles commercially available candy. Edible cannabis products may not be shaped like people, cartoons, or animals. Businesses that violate the rules may be required to remove products from sale and could face fines of $500 for each affected item. The law is intended to reduce the risk that children or teenagers mistake high THC products for ordinary food or candy. Cannabis processors and retailers support the goal, but say the phrase, "attractive to children," leaves substantial room for interpretation. Packaging decisions can also involve large financial commitments. Manufacturers may order tens of thousands of printed bags before receiving an inspection. Oklahoma Medical Marijuana Authority Executive Director Adria Berry says enforcement will focus on products packaged on or after November 1st. Ordinary flavor descriptions, including words such as strawberry, may continue when the overall design is not directed toward children. Some businesses want regulators to review packaging before it is printed. Oklahoma's cannabis agency cannot establish such a system without legislative authorization. Until lawmakers act, companies must prepare for the new standard while waiting for clearer boundaries between an acceptable commercial label and one considered appealing to minors.
Nebraska is establishing the business framework for its medical cannabis program, but a complete route from cultivation to patient sales is still taking shape. The Nebraska Medical Cannabis Commission has advanced a draft fee schedule for licensed operators. The proposal includes a $5,000 application fee and a recurring $13,000 charge for the state's seed-to-sale tracking system. Cultivators would pay $20,000 for an initial license and $23,500 for annual renewal. Product manufacturers would pay the same initial fee. Their annual renewal would cost $23,500 without transportation authority or $28,500 with it. Dispensaries would pay $15,000 initially and $18,000 for renewal. Manufacturers could obtain transporter certification for an additional $10,000. Once the tracking charge is included, annual state costs would begin at approximately $31,000 for a dispensary and could reach $41,500 for a manufacturer authorized to transport products. Nebraska permits 4 cultivators, 4 manufacturers, and 12 dispensaries. All 4 cultivation licenses have been issued, and 1 cultivator may begin growing. At least 2 businesses have applied for manufacturing licenses. Dispensary applications have not yet opened. The permitted product range is narrow. Nebraska prohibits cannabis flower for smoking, vaping products, and all edibles. Approved forms include tablets, capsules, tinctures, topicals, patches, and certain inhaled liquids or oils. Cultivation is now beginning, but patients will also need licensed manufacturers, testing services, transportation, and dispensaries before the system approved by voters in 2024 becomes fully operational.
Georgia offers a contrasting picture: an established medical cannabis program expanding rapidly after new rules took effect July 1st. The state's active patient registry has passed 41,400. Approximately 4,700 patients joined during the first 3 weeks of the expansion. That represents more than 10% of the current registry and more than twice the number of new enrollments recorded in the previous 3-week period. The changes came through Senate Bill 220, the Putting Georgia's Patients First Act. Registered patients may now possess up to 12 grams of THC, and medical cannabis products are no longer restricted by the previous THC percentage cap. Patients aged 21 and older may access vaporizable products, including flower. Dispensaries may also offer edibles and other full-strength products, expanding a program that had centered largely on low THC oil. Eligibility has widened as well. Cancer, multiple sclerosis, and Parkinson's disease no longer need to be classified as severe or end-stage. Lupus has been added to the qualifying list. Dispensaries are reporting an immediate response. FindFettel says customer traffic roughly tripled during July. On the first day of the expansion, patients began lining up about an hour before its Decatur location opened. Georgia maintains a tightly limited business structure: 6 cultivation licenses, 15 retail licenses, and 1 independent testing laboratory. The state allows another retail license for every 10,000 new patients. The first 3 weeks of growth brought the registry nearly halfway to that threshold. Georgia's expansion remains medical. It does not legalize recreational sales or purchases by adults who are not registered patients.
Massachusetts cannabis regulators have released a new tracker showing where recreational delivery is permitted and where local governments have temporarily blocked it. 13 municipalities have adopted adult-use cannabis delivery bans. 11 selected the maximum 2-year prohibition, while 2 approved 1-year bans. Medical cannabis delivery operates under a different rule and remains permitted statewide. A local government may block recreational delivery, but it cannot prevent registered patients from receiving medical cannabis products. Adult use delivery is available across most of Massachusetts. The state has licensed 8 marijuana couriers and 17 marijuana delivery operators. Since June 2021, these businesses have facilitated or directly generated approximately $74 million in gross sales. They employ 324 registered delivery agents. Cannabis Control Commission Executive Director Travis Ahern says delivery services can operate safely and discreetly while generating local tax revenue. The new tracker also covers recreational stores and municipal zoning for social cannabis consumption. No Massachusetts municipality has yet approved zoning for social consumption. For consumers, access depends on 2 distinctions: whether the delivery is medical or recreational, and whether the local government has adopted a temporary adult use ban. For businesses, the tracker offers a clearer map of potential service areas and the dates on which local restrictions may expire.
The Massachusetts delivery sector is growing, but voters will soon decide whether the broader recreational market should continue to exist. A marijuana repeal initiative will appear as Question 8 on the November 3rd ballot. The State Ballot Law Commission ordered the measure onto the ballot after rejecting a challenge to its petition signatures. Organizers needed 12,429 certified signatures in the final collection round. They submitted 12,551, leaving a margin of 122. Opponents challenged signatures they described as fraudulent, illegible, or incomplete. They also questioned petition sheets containing missing addresses, stray marks, and formatting differences. The commission invalidated 4 signatures because of incomplete address information. It declined to reject 231 signatures over stray markings, finding that the marks appeared accidental and did not materially change the petitions. The commission also rejected a challenge involving 99 signatures alleged to have been written by the same person. A handwriting expert found the evidence inconclusive, and the commission determined that the allegation had not been proven. Question 8 would repeal the laws permitting regulated recreational marijuana sales and home cultivation. Possession would remain legal, and the state's medical cannabis program would continue. The result would be an unusual system. Adults could legally possess marijuana, but licensed recreational stores and legal home growing would no longer provide a lawful source for non-medical consumers. Cannabis businesses and legalization supporters have formed the Stop the Repeal campaign. The Coalition for a Healthy Massachusetts supports the initiative and plans to focus its campaign on public health and community concerns. Current Massachusetts cannabis law remains in effect. The final decision now belongs to voters.
Those are the major cannabis policy and business developments we are following this week. We will continue tracking the approaching deadlines in Virginia, Oklahoma, and Florida, the developing programs in Alabama and Nebraska, Georgia's patient growth, and the Massachusetts campaign over Question 8. This podcast is released every Saturday at 9 a.m. Eastern. New to the program? Subscribe on your preferred podcast platform or on YouTube so you do not miss next week's edition. Already subscribed? Please press the like button. It helps more listeners find the program. Thank you for listening.